My role is quite simply I try and stop people smoking. When people try to give up smoking, they need help. They can't necessarily do it on their own. So what we do is we train the midwives to help them to talk to the ladies who then so they can explain about the stop smoking services. When we've got the stop smoking services in all of the cities around the country, fortunately, we're very fortunate in that. And what they do is they give us a referral card and they send it to us and they say, you know, we'd like you to come and help this lady to give up smoking, which is what we do. So then we go to the place, we either go to coffee shops, we go to houses, we go to hospital, wherever the lady wants to be seen is where we go. So what we do is we go and we see them and we take the service to them. We give them anything that they need to help them give up smoking. We show them that we're quite, you know, sympathetic to what they're talking about. We're very friendly. We're not going to bite. We're not going to tell them off. This is their choice, and all we're doing is we're just there to help them give up. And that's the main important thing. My particular role is that I'm trying to help the midwifery service by enabling the woman to do the best that she can for her baby by helping the baby give up smoking as well as the mum, because the baby actually does smoke when the mum smokes. So I need to make the midwives aware of what smoking does to pregnant women and their babies. I need to make their partners aware. We need to make GPs aware. We need to make all the associate services, the social services, anybody who surrounds care. And we have a duty of care to make everybody aware of how difficult it is to give up smoking as well. It's not just about giving up smoking, it's about helping people to understand. One of the main things is that we get a lot of people who sometimes make it so that they're awkward. They don't want to give up smoking. I'm going in there and they only want to do it for their baby. So they're not particularly keen to give up smoking. So in many ways, it's one of my roles to try and help them to understand what smoking's doing. And by doing that, help bringing them to some sort of understanding. But that doesn't mean that they're going to do it. For example, if you've got a lady who doesn't want to give up smoking, she can't give up smoking, she's tried loads and loads of times and is unable to give up smoking, then I need to try and explain to her or get her to understand that it's not just about doing it at that moment. We can work with her, we can cut down. If she doesn't want to quit straight away, I will go and I will help her work her way through it, so that eventually, if she's not quitting straight away, she's actually starting to cut down so that baby gets less and less of the smoke, if you like. So it's helping her to understand, you know, what it is and how we can help her. There are many women as well who actually don't feel that they need help because their partner doesn't want them to, because we actually help partners as well and they don't always understand that. But the partner doesn't want them to, their family doesn't want them to, everybody in their family smokes. Very difficult to try and help someone who is living in a situation where everybody smokes around them, and although they may be desperate to give up, their family necessarily won't help them. And there are people, sadly there are people like that. We also have people who have given up before, who found it a struggle then and don't feel that they're able to do it. It's about helping them to come to some understanding that, yeah, we can help them. Yes, although they may have tried and given up probably 10 times and never been successful, in actual fact, this may be their one time that they can actually do it. So it's about, and they're asking loads and loads of questions, so we always need answers. We always need to be explained to them sympathetically that we understand where they're coming from. We're also, you know, we'll come and talk to them about it. We won't demand that they give up smoking because it's always their choice. It's as simple as that, really. We help every member of the family around them who smoke. So we help the woman who smokes, who's pregnant, her partner, her mum, her dad, her brother, her sister, her mate, her next door neighbour, a best friend who comes from Northampton or somewhere around miles away. We will help them, providing they're in the same place.